services?
Well, at the Baptist Breast Network, we really do provide a full menu of both radiologic services for women who need screening mammography, further in-depth mammography called diagnostic mammography and ultrasound, tomosynthesis, which is a very sophisticated form of mammography. In addition to radiologic services, we offer, importantly, navigation for women who need further evaluation and care for breast disease, either precancerous lesions or cancer, and also genetic services. So certainly some forms of breast cancer are inherited, and there's risk for family members and for the patient that would change her care. So that's also offered at the breast center.
Okay. And I know that Andrea had wanted to talk about navigation and how important that is. Why is navigation important for women going through this?
For women who are diagnosed with either precancer or cancer, it can be quite daunting and anxiety-provoking. It's a multidisciplinary approach, which means multiple specialists are involved in patients' care. And in order to best get that care in an efficient, timely fashion, navigation, nurse navigation is key. So at the Baptist Breast Network for cancer care, specifically at the Baptist Breast Center, we have navigators who are registered nurses, very knowledgeable, experienced in cancer care, to help patients by information delivery and hand walk them through the process of getting the appropriate consultations, the appropriate studies, and what we call timeliness to care. So it's a very personalized approach. Imagine a concierge at your favorite hotel. That's exactly what breast navigation provides.
Okay. Talk about the surgical options for women these days, and I guess the outcomes that folks are getting, as opposed to like many years ago,
Sure.
where people might be afraid that things aren't as good as they don't know about.
Yeah, historically, breast cancer surgery was rather aggressive, radical, with removal of the entire breast, muscles, lymph nodes. And we are well into the era of less is more. We can achieve for patients through breast salvage surgery or conservation surgery the ability just to remove the tumor, sample lymph nodes, and provide equal care compared to a very radical approach. So I think a lot of patients come in thinking that when they're faced with the diagnosis of breast cancer, and often it's managed surgically first, that a woman is looking at very radical, very aggressive surgery. When in fact, breast conservation surgery is day surgery. Patients come in the morning, go home later that afternoon, and they go home cancer-free. So again, we are able to affect change without the need for very radical surgeries whatsoever.
Awesome, perfect. Then I guess just mammography, encourage women to, why is it so important?
Mammography, along with self-breast examination, remains our best tools for early detection. We know that mammography annually, in my opinion, there has been some controversy as of late, is fundamental in being able to detect lesions that may one day become cancer, but aren't, and can be biopsied and managed accordingly. So it's very, very important, especially now when a lot of annual screening mammography has been delayed because of COVID, that we remind our patients, that women be reminded of the importance to invest in their own health. I'd rather see a patient with a cell being diagnosed on biopsy that's several steps away from ever becoming cancer, being able to affect change by talking about risk reduction and therefore never having to deal with breast cancer. Similarly, if breast cancer or a precancerous lesion is detected by an annual mammogram, it's often detected at a time when it's very, very small, and we have a really, really high chance for cure. So I think that, in fact, it's been shown that mammography plays the key role in early detection for breast pathology.